Extra. No.
Natural and artificial methods of contraceptives. Kinds of artificial methods: oral contraceptives, transdermal patch, vaginal ring, subdermal implants, hormonal injections, intrauterine device, chemical barriers, diaphragm, cervical cup, male condoms, female condoms, surgical methods. Oral contraceptives are drugs that are used to prevent pregnancy. The primary action of these products is to prevent the release of an egg from a woman's ovary. Oral contraceptives comes in packets of 21, 28, or 91 tablets to take by mouth once a day, every day, or almost every day of a regular cycle. Transdermal patches. Transdermal patches are a well-established method of drug delivery offering many benefits to patients. Transdermal patches adhere to the skin as a way to deliver drugs. They provide specific, predetermined dose of medication that is absorbed through the skin and into the bloodstream. Therefore, transdermal patches offer a non-invasive and painless method of drug delivery with the added benefit of providing a consistent therapeutic dosage over a predetermined time period. Vaginal ring. Vaginal ring are a soft plastic rings that contain two hormones, the estrogen and progestogen. These are similar to hormones that are produced by the ovaries and used in the pill. To use a vaginal ring, squeeze the ring and insert it into the vagina. It says for it stays for 3 weeks in the vagina. After it, take it out and throw it away. Then wait 7 days before inserting a new ring. Subdermal implants. Subdermal implants involve the delivery of a steroid progestin from polymer capsules or rods placed under the skin. The hormone diffuses out slowly at a stable rate, providing contraceptive effectiveness for 1 to 5 years. The period of protection depends upon the specific progestin and the type of polymer. The subdermal implants is placed under the skin of the upper arm. Hormonal injection. Hormonal injection prevents pregnancy by injecting a synthetic version of the hormone progestogen called dipot medroxyprogesterone acetate or DMPA. The injection is also called Depo. Depo prevents the body from producing its own hormones and releasing eggs from the ovaries. It is given as an intramuscular injection into the upper arm, and over the next 12 weeks, the DMPA is slowly released into the bloodstream. To prevent pregnancy, an injection must be given every 12 weeks. intrauterine device or IUD. An intrauterine device or IUD is a small contraceptive device that is put into the uterus to prevent pregnancy. There are two types of IUD, the copper IUD and the hormonal IUD. The copper IUD is a small T-shaped plastic and copper device that constantly release a small amount of copper into the uterus. The hormonal IUD is a small T-shaped plastic device that slowly releases hormone into the uterus. The IUD is inserted inside the uterus by a trained doctor or nurse. It has a fine nylon thread attached to it which comes out through the cervix. Chemical barriers. Chemical barriers or spermicides are sperm-killing substances available as foams, creams, gels, films, or suppositories which are often used in female contraception in conjunction with mechanical barriers and other devices. Spermicides or chemical barriers are usually available without a prescription or medical examination. Diaphragm is a small dome-shaped latex cup with a flexible ring that fits over the cervix. The cup acts as physical barrier against the entry of sperm into the uterus. A diaphragm is usually used along with spermicide. Diaphragms can be inserted up to 2 hours before sex because spermicide is only effective for 2 hours. If the woman inserts her diaphragm more than 2 hours before intercourse, she will have to insert more spermicide into her vagina. As a general rule, diaphragm should be replaced every 1 to 2 years. What is a cervical cup? A cervical cup is a small silicone or rubber cup you insert into your vagina before sexual intercourse to help prevent pregnancy. It covers your cervix so sperm can't reach an egg. Suction helps it stay in place. It must be fitted and prescribed by your healthcare provider. Cervical cups create a physical barrier to prevent sperm from entering your cervix and uterus. It's a form of birth control. Cervical cups create a physical barrier to prevent sperm from entering your cervix and uterus. It's a form of birth control. Cervical cups are most effective when used with spermicide. They're available by prescription and come in 3 different sizes. Ask your healthcare provider to help you insert your cervical cup the first time or follow the instructions on the packaging. Your cervical cup needs to be fit tightly and covered your entire cervix. Before its use, check the cup for holes or other damage that may allow sperm to sneak through the barrier. If your cervical cup is damaged, don't use it. Condoms. A male condom is a covering made to fit over a man's erect penis. It can also be called a rubber, sheet, or skin and is known by many different brand names. It works by providing a barrier between partners during sexual intercourse, so that bodily fluids such as semen and blood are not shared. As a result, pregnancy and reproductive tract infections or RTIs, including human immunodeficiency virus or HIV and acquired immunodeficiency syndrome or AIDS, can be prevented. Most condoms are made of thin latex rubber. Some condoms are coated with a dry lubricant or spermicide. Different sizes, shapes, colors, and textures are common. A female condom is a thin, loose-fitting and flexible plastic tube worn inside the vagina. It has inner and outer rings. A soft ring at the close end of the tube covers the cervix during intercourse and holds it inside the vagina. Another ring at the open end of the tube stays outside the vagina and partly covers the lip area. The female condom helps protect partners from pregnancy and STIs, including HIV and AIDS. It is the only female control device offering this protection. Like the male condom, the female condom provides a barrier between partners during sexual intercourse to prevent the sharing of bodily fluids like semen and blood. This ensures that pregnancy does not occur and STIs are not transmitted. The woman has to squeeze the ring at the close end of the tube. She can use her other hand to spread the outer lips and insert the squeezed condom into the vaginal canal. The inner ring should be pushed just past the pelvic bone and over the cervix. After insertion, she has to make sure that condom is not twisted. Surgical methods. They are also called terminal methods of family planning. Surgical methods are permanent methods of family planning where there is no need of replacement or augmentation, but the reversibility is poor. The methods are operative procedures which block the passage of semen in males and ova in females. The techniques are also called sterilization procedures. They are called vasectomy in males and tubectomy in females. Vasectomy or for males. This is a method of sterilization in males. In this method, each duct or vas deferens is cut and tied or ligated at both ends by a thread. The small piece between the two ligatures is then removed. By doing so, the sperma cannot reach the ejaculatory duct and hence cannot be deposited in the female reproductive tract during intercourse. This procedure is easy and quick and has no harmful effect on manliness of any kind and does not reduce libido. Tubectomy or for females. This is a method of sterilization in females. It involves cutting of the fallopian tubes or oviducts and tying the ends. Kinds of natural methods: abstinence, calendar method, basal body temperature, cervical mucus method, symptothermal method, ovulation detection, coitus interruptus. Abstinence can mean different things for different people. It may mean no sexual contact of any kind or not having certain kinds of sex. For a variety of reasons, a person may choose abstinence at some point in their life. You can still choose abstinence even if you have had sex in the past. For birth control, abstinence means not allowing sperm or ejaculate or pre-ejaculate near the vaginal opening or inside the vagina. For the prevention of sexually transmitted infections or STIs, abstinence means no genital to genital or mouth to genital contact. Calendar-based methods are various methods of estimating a woman's likelihood of fertility based on the record of the length of previous menstrual cycles. The rhythm method is a form of natural family planning to help identify when a person is ovulating. It's done by tracking a person's menstrual cycles on a calendar to either avoid or engage in sexual intercourse during a person's fertile days. The basal body temperature method, a fertility awareness-based method, is a type of natural family planning. Your basal body temperature is your temperature when you're fully at rest. Ovulation may cause a slight increase in basal body temperature. You'll be most fertile during the 2 to 3 days before your temperature rises. By tracking your basal body temperature each day, you may be able to predict when you ovulate. This may help you determine when you're most likely to conceive. Basal body temperature can be used as a way to predict fertility or as a part of a method of contraception by helping you gauge the best days to have or avoid unprotected sex. Tracking your basal body temperature for either fertility or contraception is inexpensive and doesn't have any side effects. Some women may choose to use the basal body temperature method for religious reasons. Cervical mucus methods help you predict when you're going to ovulate by tracking the changes in your cervical mucus or vaginal discharge throughout your menstrual cycle. To use the cervical mucus method to prevent pregnancy, you check out your mucus every day and write the results on a chart. The changes in your mucus help you figure out when you're going to ovulate and are able to get pregnant. During your safe days, you can have unprotected vaginal sex. Symptothermal contraception is a birth control method in which women collect information to inform themselves of their menstrual cycle. This method depends on observations during the menstrual cycle of signs and symptoms and that correlate with different hormone level as indicators for an approximate time frame when ovulation is likely to occur. Due to the data collection that is required by the patient, symptothermal contraception is commonly referred to as a fertility awareness contraceptive method. This is a test that are urine-based tests which work in a similar way to pregnancy test. However, this sticks measures the luteinizing hormone or LH, which triggers ovulation rather than the pregnancy hormone beta HCG. You buy a packet of sticks, pee on the sticks every morning, and as you get closer to the ovulation, the strap on the stick gets stronger. It is also called the withdrawal method that happens when you take the penis out of the vagina and ejaculate outside the vagina to try to prevent pregnancy. The goal of the withdrawal method is to keep sperm from entering the vagina. Using the withdrawal method for birth control requires self-control. Even then, the withdrawal method isn't an especially effective form of birth control. Sperm may enter the vagina if withdrawal isn't properly timed or if pre-ejaculation fluid contains sperm. The withdrawal method doesn't offer protection from sexually transmitted infections.